while there is uncertainty as to whether acetaminophen, the active ingredient in Tylenol, is a cause of some autism spectrum cases and or attention deficit hyperactivity disorder, there is no uncertainty over the fact that the general consensus right now is that we do not have a full answer about this, and no new news has been made in the last week to justify that conference. The uncertainty around this arises from the fact that we can't and don't do randomized trials on pregnant women, and we therefore end up relying on various observational studies to identify a correlation, but not necessarily a causation. And with acetaminophen, there are enough studies that raise some concern to be worthy of our attention. Just to be clear, there's so much unknown that even if one says they have a real concern, it should be noted that the level of impact, even if it's real, is likely very, very low. But low is still something to consider. The issues that end up being raised are confounding factors. Are women taking acetaminophen for mostly random reasons, and therefore if you see a correlation, it likely means it's causative? Or are they taking acetaminophen because they have migraines or high fevers or something else that correlates with taking acetaminophen rather than the acetaminophen itself, in which case you're actually dealing with correlation, not causation? Studies have tried to tease this out, but they can only do so much. And the scientific consensus is that we do not know the answer. And one of the best recent studies involving siblings in Sweden comes to the opposite conclusion of the president and his healthcare staff. We must get better answers to this question, but my serious quarrel with the news conference is not that the information is wrong. It is that the guidance to women should be coming from trusted professionals and not from those who might be leveraging the anxiety of the public over growing counts of autism cases. And I specifically use the word counts because it is unclear how much of the growth in cases is actually due to finding cases that were never previously identified versus some genetic or environmental factors that might be changing the numbers that we're actually seeing. We should absolutely be searching for answers and then providing them with deliberateness, thoughtfulness, and compassion, not for political points. I also want to highlight that we should all consider what we put in our bodies has some risk of untoward effects. Acetaminophen may be an over-the-counter medication, but it is not without its own risks. And recent changes to labeling even remind us that lower total consumption is safer and better. So it should always be the case that we advise patients, all patients, to take the lowest amount of a medication that will satisfactorily resolve symptoms for them under the guidance of their physician or nurse practitioner, etc. For women, for pregnant women, there are no other safe pain or antipyretic or anti-fever remedies. If there were, we would have a different conversation today. Also a reminder, there have been numerous fake-outs over the last century. We once thought ulcers were caused by stress, that hormone replacement therapy reduced the risk of heart disease, that AIDS was caused by environmental factors, that vitamin E was cardioprotective, that beta-carotene protects against lung cancer, or that tonsillectomy was protective against future infections. All of these, to one degree or another, have been disproven, occasionally even proving the opposite. It is why we do not jump the gun on science, or at least we try not to. It is just as important, and I want to emphasize this, for those mothers of neurodivergent children out there to understand that while many of them may start to blame themselves for causing differences in their children, the weight of the evidence is strongly against this hypothesis. For women who are currently pregnant, talk to your OBGYN or primary care provider to make the best decisions for you and your fetus. Important to highlight that suffering in pain or with fever may in fact be very harmful, so please seek advice.